Hi, I'm David Pope from Clinical Edge. Welcome to this week's 5-minute physio tip on the myths of specificity and functional training. So the question is, do you need to be really specific to the person's function? Do you need to, if the person has pain during a functional task, do you need to retrain that functional task? For instance, squatting. Do you need to retrain their squat or their leg press if that's the movement that's really important to them and they've got pain during it? Or are you best off performing other tasks? So let's take, I'm sure at uni you learned principles of specificity, that you had a specific adaptation to a specific demand. So for instance, if you were training your biceps and you strengthen them between 80 and 120 degrees of elbow flexion, that you got stronger in that range, but you didn't get stronger in other ranges or other movements related to your biceps. Makes sense, but how true is it? So let's take, for example, leg press. Your patient's got patellar tendinopathy, they've got pain, anterior knee pain in the patellar tendon while they're performing a leg press, but they really want to get back to it. So can we just get them doing squats or leg presses as their patellar tendon loading program? Or do we need something else that's unrelated to the squats or leg presses that they want to do? So there was a really interesting study that compared one-legged leg press in patients with patellar tendinopathy and looked at their strength. And what they found was that their strength in the leg press in their affected side was just as strong, if not stronger, on their affected side as it was in their unaffected side. But when they compared their quadriceps strength with isokinetic knee dynamometry, they found that their knee extension strength was decreased. So their quadriceps didn't have the strength, their patellar tendon was, it didn't have the load capacity that it would have, despite having great strength in their leg press. So how does that work? You can imagine if you're performing a leg press and you're pushing, let's say for instance, 100 kilos. You can either achieve this through loading your quadriceps a certain amount, or you can tie in other muscles, so for instance your glutes, calves, hamstrings, and then take up the remainder with your quadriceps. So you can get around it, you can work around holes in your kinetic chain by just incorporating other muscles and other areas to achieve the same desired output, for instance 100 kilo one leg press. So if you just perform squats or leg press as your functional retraining for a patellar tendinopathy, are you really going to load that patellar tendon enough to increase its load capacity? No, because you're not actually loading the quadriceps enough to have a stimulating effect. So in this case, you really want to step away from your specific functional exercises, your squats and your leg presses, take it back to a more isolated exercise. For instance, you're starting with isometric knee extension and then getting the load capacity of the quadriceps tendon up, and patellar tendon, increasing that strength, and then after you've built that strength up, then you can incorporate it back into those sort of functional exercises so that you've got the load capacity there, you can actually incorporate your quadriceps and get that load onto the quadriceps and patellar tendon. So that's a really good example of when you need to be non-specific, but then bring that specificity and functional retraining back in later to tie that whole kinetic chain together. So when you're looking at all your exercises and trying to decide, do I need to make this really functional if it's a compound movement, if say for instance they're having pain with push-ups or any others, or throwing, do we need to retrain that specific task? Oftentimes you can address the specific components related to it early in the treatment. It doesn't need to be specific and functional to their throwing, for instance, but you can break it up into components, tie it all together later, and it works really well. And it lets you address each of those individual components. So that's all for this week's 5-minute physio tip. Hope you've enjoyed it. If you've found us anywhere else besides on our blog over at clinicaledge.co, head on over, check out all the podcasts, the blog posts, the videos that we've got for you there. Have a great week.